Good evening once again, colleagues. We realize today still we are going to be looking at our pharmacology. We have covered a few things. Yesterday we were looking at electrolyte replacement drugs, looking at the potassium, the sodium, the magnesium, the different drug interactions. We were looking at the pharmacotherapeutics, when to be indicated, when not to be indicated, when those drugs are supposed to be used interdependently. Really, we were delving deep in seeing mostly the sodium potassium pump, and what took us a lot was things to do with the bone resorption, things to do with the introduction to calcium, understanding this as being one of the extracellular fluids available in the body. And we also appreciated the role that vitamin D plays in the body, it being essential for bone health and also enabling calcium utilization. Among those, we saw a lot of things to do with vitamin D deficiency, and we saw how vitamin D is synthesized, the egocalciferol and the cholecalciferol, vitamin D2 and also vitamin D3, I should say. We also saw the treatment, looking at exposure to sunlight being partly a treatment, around 10 to 30 minutes, I should say, for several times a week. This will help the body synthesize vitamin D. Right. So today we are going to engage deeper into looking at how also other vitamins play vital roles in our pharmacology today. So by the end of this engagement, I want you to be able to understand the definition and the classification of the different vitamins. And this I know you have been covering through your science classes that you have been undertaking. And the same also, you should be able to explore the biochemical roles of vitamins in the body. What do they play? And this, on a deeper level, we'll be looking at things to do with a few structural components and how the different structures play their different roles in supporting the optimum health or the overall health, I should say. We are also going to be able to examine the pharmacological effects of vitamins, and we will also be able to identify those disease conditions that are really associated with inadequate intake that leads to vitamin deficiencies, or if we are taking in vitamins in excess. And also we will be able to discuss the therapeutic uses of vitamins. When we talk about therapeutic use of a vitamin, we are trying as much as possible to talk about the drug use of that particular vitamin. How can it be used as a drug? Right. I think this is where people come up with the statements that food is medicine, because these are partly the components that we find in our local foods, but then we tend to use them as drugs to alleviate some conditions and symptoms. So when we talk of vitamins, we are saying these are organic molecules, really, and these are essential for normal metabolism and also biochemical processes that take place in the body. Really, you could bear with me that we've been understanding the different roles that these play. We've looked at vitamin D supporting coagulation. We've looked at vitamin C supporting iron absorption, but also we've looked at vitamin C treating influenza-like symptoms. But also, point to note, we saw niacin that was able to Yeah, we are saying they are essential for normal metabolism and biochemical processes, and we are saying they act as coenzymes activating anabolic responses, and really they are needed in small amounts or small quantities. These are what we call micronutrients, and these are vital for growth, repair, and also maintenance of tissue. So we have what we call the water-soluble vitamins and the fat-soluble vitamins. And as you can hear, the name sounds, for the water-soluble vitamins, these ones are easily dissolved in water and they're easily excreted, since the most form of excretion that we use is through liquids. We sweat, we cry, tears, we urinate, and etc. Vomit. So all that can be the route for excretion of these water-soluble vitamins, along with those contents that go therein. And for the fat-soluble vitamins, we are looking at these that are dissolved in fat and are stored around in the liver, and also the fatty tissue. For the examples of the water-soluble vitamins, we have all the B group vitamins, or what we call the vitamin B complex, from vitamin B1 to vitamin B12, and also the niacin, the vitamin C. Okay. Examples of the fat-soluble vitamins, we have the ADEK vitamins. You could call them ADEK as an abbreviation. That's when we are talking of vitamin A, vitamin D, vitamin E, and vitamin K. So all those are fat-soluble vitamins. That's why you need to understand that these particular vitamins, when are they going to be fully absorbed? If someone is being limited in the amount of, for example, cholesterol they are taking, we saw that if someone's cholesterol levels are being limited, or the amount of fat that they are taking into their body being limited, this could impair absorption of some of these vitamins. That is when we talked of niacin being able to help us in hyperlipidemia, if you're around that session. All right. So what is the importance of the water-soluble vitamins? Okay. The water-soluble vitamins, mainly the vitamin, the group B vitamins, help the body for synthesis. Sorry. This is essential for energy production. Okay, the water-soluble vitamins, basically the B complexes, you will find them that they help us in metabolism. Okay, in metabolism of the various products that we are putting into the body. So for these ones, in their role, acting as coenzymes and also cofactors, they are involved in energy production, and also some people are talking of the amino acid metabolism, the vitamin C synthesis. Also, we talk of collagen synthesis, that is for the vitamin C. That is where we are looking at also the antioxidant properties too, and also we talk of the DNA synthesis and DNA repair. So all these, we are saying they cannot be stored in the body, so we require a regular intake of these particular vitamins. We are not saying these are the only roles or the only importances of those vitamins. You understand that there are other forms of there are other importances of these ones, but we do not want to go into those nitty-gritties. We understand that you could go and look up those ones online and also read more about them. So when we talk about these fat-soluble vitamins that are absorbed through the dietary fat, like we had said, and then being stored in basically the fatty tissue of the liver, we have the vitamin A that is key for the visual. That is what we know it of corneal ulcerations, conjunctivitis. Apparently, there is a study that I'm trying to, I think my research subject could be around school feeding and conjunctivitis. We had an outbreak of conjunctivitis. I think it's 2 months back when red eye was present among schools. So it is something I want to look at for my dissertation. So we understand that vitamin A plays a key role in visual health, but it's not only that. We talk of skin health. We talk of also other functions. Maybe we would also talk of the immune system, it being able to boost the immune system. When we talk of vitamin E, we are looking at its antioxidant properties. And these ones, we remember when we're looking at cancer, we are talking of these antioxidant properties being key in protecting those that damage, protecting the cells from that damage that could be caused by free radicals. Once free radicals bind, they could cause cellular mutation. Cellular mutation could lead to malignancy, and cancers are starting to happen. Vitamin D, like this, we had talked about the bone health. We had talked of the calcium absorption. For vitamin K, we are talking about blood clotting, and also small evidence has been known for vitamin K to bring about gene expression alongside with vitamin D. And really, we understand that really, though they are not are like water soluble vitamins. These ones can be stored for the longer period since we have a lot of fat, unlike for the water that we are currently excreting. They are always. So here we are going to understand what we mean by mega dosing, and we are saying here we are looking at 10 or more times the recommended amount. And here there are some situations where this mega dosing of vitamins is essential, but sometimes it could become a disaster, okay, if it is not properly managed. Examples, you're looking at long-term drug therapy and also malabsorption symptoms, things to do with pernicious anemia. We are trying as much as possible to exceed the recommended dietary intake of these. And also, we are saying for things such as the water soluble vitamins, we are looking at excess amounts usually excreted through urine. So, we understand that mega dosing is sometimes key. So, though we talk about them being excreted, we could indicate mega dosing in cases of deficiencies, but also we should take into consideration that it could lead to gastrointestinal issues and also we could talk of toxic levels leading to nausea, vomitings, and also for now these fat soluble vitamins, we could start talking of organ damage, which we do not want to be a risk, since we are also trying as much as possible to talk about. We are trying as much as possible to improve the intake and the overall health of the video. So now when we talk about the characteristics of the fat soluble vitamins, we are looking at them being what do they share? The ADEC vitamins, what do they share? We are talking of them storage being stored primarily in the liver, and we are talking about their slow metabolism and slow excretion. Okay, unlike the water soluble vitamins, these ones are in the fat, in the oil, and etc. Okay, and also their storage capacity being in the liver, that means that you don't need to frequently consume these fat soluble vitamins as frequently as the water soluble, because you know how weight loss through reduction of fat is sometimes a little bit challenging. So we could have amounts of fat soluble vitamins that are present always and do not need to be replenished as regularly as the water soluble vitamins. And we are saying once these ones absorb, they experience slow metabolism and excretion through the transport to the bloodstream. We have the lipoproteins, those we had seen with the cholesterol metabolism, the lipid metabolism, I should say, and also we are saying excretion of the fat soluble vitamin is not readily excreted in the urine, like we talked about the water soluble vitamins. And if this stored in the body, they will just increase the toxicity. So therefore, we are trying to say that we need to understand that consuming these fat soluble vitamins is also supposed to be regulated. And now let's delve further and look at vitamins, specifically vitamin one by one. Right, so now let's look at vitamin A to begin with. And we are saying that this, like we had seen, is a fat soluble vitamin, and we are going to be looking at the food sources and its derivatives. Okay. Yeah, we had said it is essential for vision, where we are saying particularly in low light conditions. Those rods, the cells, the rods, the cones. I hope you covered that in your biology. The rods, the cones, looking at the rhodopsin, functioning of the retina, etc., temporal blindness, and all that. You remember things to do with that. The whole process of how the light the light reaches the retina. Right. So vitamin A or retinol has the symptoms of the deficiencies related to this condition. Like I said, it's not only the it is not only the vision, but we also have the immune function, we also have skin health, and also there has been known research to be done about the importance of growth, vitamins A, the role it plays in growth, and this study was done on mice, if I'm to remember correctly. Right. So for the food sources and derivatives, we are saying this could be got from eggs, it could be got from fish oil, since it being a fat soluble vitamin. But also we have those plant-based foods such as the carrots that give us the beta carotene and the carotenoids. For example, I should say. So vitamin A effects, the toxic effects of vitamin A, we are looking at a risk of hypervitaminosis, especially in children. And that's why you see that if vitamin A is being given to children, I'm forgetting, is it 20,000 nanograms? I'm forgetting what that thing is about how much vitamin A is supposed to be given to children. Right, but yeah, it's supposed to be carefully monitored due to their smaller body size and also their lower tolerance levels. Okay, yeah. And if it is given excessively, we are looking at it causing toxicity, we are looking at it causing headaches, and also this could lead to a severe liver damage. Somehow you could look at the intracranial pressure and also lethargy. When we talk of lethargic conditions, we are talking about a person who is failing to is feeling restless. Okay, I think that could be the that could be the simple explanation for lethargy. That far. Right, so now let's look at the contraindications of vitamin A. When not to give vitamin A. So this is contraindicated for individuals who may have been on as a drug product allergy and are in current state of hypervitaminosis when there is a lot of vitamins. Okay, yeah. Okay, so we are also looking at some studies showing that there could be side effects of if there are known side effects of this vitamin A regimen, then you do not need to be prescribing these supplements to that individual. Okay, yeah, because however much we want however much you want the importance of the vitamin, you do not want to risk the toxicity. And also interaction with lubricant laxatives and cholestyramine may also reduce the absorption of vitamin A. Alright, so what are the adverse effects of vitamin A? The adverse effects of the vitamin A, we are looking at headaches, we are looking at this due to the increased intracranial pressure, the lethargy, the malaise, and also we are looking at that is to do with the central nervous system. But then for the gastrointestinal system, we are looking at nausea, we are looking at vomiting, anorexia, and abdominal pain. Right. And for the intergumentary, we are looking at the dry skin, we are looking at purities, and also increased pigmentation. You remember I had told us that vitamin A is also essential for skin health. Right, and then for the metabolic, we have hypermenorrhea, we have hypercalcemia. Remember when we were talking about hypercalcemia a lot, increased levels of calcium in blood, and also for the musculoskeletal, we have arthralgia and also retarded growth, since it is important in development thus far. Right. So what are the forms? What are the forms and pharmacokinetics of vitamin A? Like we have said that vitamin A exists in three forms. We have the retinol, we have the retinyl palmitate, and also we have the retinyl acetate. Okay, so mode of delivery route usually for the vitamin A, this is given orally, and it has its onset of action is not known, and this is dependent on that number. It is dependent on various factors, on various individual factors, things to do with age, things to do with the body sizes, etc. That's why we say that it needs to be carefully monitored if it is being given to children. And we are saying its half-life, all amount of time it takes to break it down to be eliminated throughout the body, it is around 50 to 100 days. I hope you got some of these definitions. The definition of half-life is always key. in your understanding how different drugs are broken down and how they're excreted out of the body. Yeah, so I hope you get that. If you do not know their definition, sometimes you need to go and look them out. There is half-life, there is shelf life, then there is efficacy, then a number of definitions therein. Okay, so the duration of action, we are saying the duration of action is not known. So those are areas for research for interested parties. Maybe at one point in time we could see someone from Bristol Institute discovering the duration and of the onset of action. When does vitamin A really kick in into the body? Right. So responsible, we are saying vitamin D. We are looking still at the fat soluble vitamins, vitamin A, D, E, and K. So now let's look at vitamin D. When we talk about vitamin D, like we had looked at it previously yesterday, we were saying that this vitamin D is responsible for regulating calcium and phosphorus utilization in the body. And we say there are two primary forms. That's when we're looking at the vitamin D. Yes, please. Is someone making a submission? All right, let's go back. I thought someone was asking something. Okay, actually, feel free to ask something, unless we could save all that time and ask the questions later at the end of the engagement. Like I was saying, that vitamin D is essential for maintaining the bone health through regulating calcium, phosphorus, and its utilization in the body. And it also plays some roles, like we had looked at its immune function in regulating mood regulation and also muscle function. But really the two primary forms we are looking at vitamin D2, which is a glucalciferol that is a plant-based source or derived from plants, and also the vitamin D cholecalciferol that is produced by the skin through exposure to sunlight. That is why when we tell you that it is sunlight that is okay, let's call it a cofactor that is essential for you to produce the vitamin D. It is not really saying that we get vitamin D from the sun. But if you look at the elementary questions, usually they talk about that what is that vitamin that is got from the sun. And right now, we do not expect you to be able to tell us that you get source, you get vitamin D from the sun, but you could talk about how its production depends on the rays that are coming from the sun. So endogenous synthesis usually provides sufficient levels of the vitamin D, which is a cholecalciferol, and we are saying that resources including fish oils, the salmon, fortified milk, and also eggs are more dietary sources of these. So normal serum levels of these are 12 to 15 nanograms per milliliter, and these are crucial for bone calcification and also prevention of osteoporosis. Right, so now let's look at the functions of vitamin D. Basically, we had looked at them, things to do with it being a key in parathyroid hormone and calcitonin to regulate the serum calcium levels. And I think we'll also look at calcium. I think you go and interest yourself to look at bone metabolism, where we'll be looking at the calcitonin, you'll be looking at the osteocytes, osteoblasts, and etc. A lot can be covered in those individual sessions. Right, so the other functions of vitamin D, we are looking at vitamin D undergoes activation in the liver, and the kidneys converting it to its active form. And the active form, calcitriol, enhances the absorption of dietary calcium in the intestines, thereby increasing the amount of calcium that is available in the body. And also we are saying it's deficiency. The deficiency of vitamin D will lead to things to do with the rickets, where we are talking of the bow legs, characterized by softness, deformities, and also muscle pain. And we are saying it maintains bone health and also prevents skeletal abnormalities due to its role in due to its role in calcium metabolism. So when is it contraindicated? For people who are having drug allergies and also hypercalcemia and also renal dysfunction. Remember we talked about the calcitriol being produced from both the liver and kidneys. And also this, remember, if someone is having the kidney disease or renal dysfunction, we are trying as much as possible not to overwork the liver. And for hypercalcemia, since we said it also increases absorption and utilization of calcium, we are looking at these elevated levels of calcium in blood could lead to toxicity. And for the toxic effects, these are manifesting in children and also manifesting as cardiovascular issues and also issues of the central nervous system. And also we are looking at gastrointestinal disturbances and musculoskeletal problems. So reduced absorption with concurrent use of certain medications such as lubricant, laxatives, and also the cholestyramine. Those are the considerations we need to take into if we are going to be indicating or prescribing these vitamin D supplements to individuals. Right. So what are the forms of pharmacokinetics? Forms, we talked of the three forms of vitamin D. We had looked at primarily two, but then, okay, let's look at the calcitriol, but really the calcitriol is primary oral use, and its onset is 3 hours, and it is indicated the duration between 3 to 5 days. And for the calcitriol, it is oral and also injectable intravenously. Here we are looking at it being used in conditions where people are having hypocalcemia and rickets. In order to increase the levels of calcium in blood, we are trying as much as possible to inject people with calcitriol. For the egocalciferol, we are looking at it being orally, and parenteral intake. Parenteral, we are looking at it being directly introduced into the blood system or the circulatory system, and this onset is 30 days and it has a long duration of action. So what are the pharmacokinetics of egocalciferol? We are saying it's an oral route. This onset is after 30 days. Peak plasma concentration is not known, and it is eliminated in 19 days. So the time it takes for a drug to be eliminated is always of key importance, because this is when you know whether you should use other drugs, whether you could opt for another treatment, or whether you could pair up drugs, or whether you could make combinations of the different drugs. But here we are looking at vitamins, and that is why it is key to understand the half-life. And also the duration, we are looking at months and years, so this gives you a long-term effect of the particular desired outcome that you want. So now let's introduce ourselves to the vitamin E, or what we call the tocopherols. Okay, yeah, and they are in the biologically active chemicals known as the tocopherol. We have the alpha, the beta, the gamma, and the delta, and we had seen that these play a very key roles in protecting the cells from damage by free radicals. Like we talked of the free radicals being able to pair up and create compounds and also mutate the cells, leading to cancers growing, and carcinogenic compounds are part of the free radicals that could be carcinogenic compounds. Those are cancer causing organisms or agents, I should say. Right, so these act as biological antioxidants and a vital component for the diet, and their deficiency, we are looking at irritability, edema, thrombosis, and hemolytic anemia. All right, and this we had talked about them as being an inflammatory agent sometime, and we are saying premature infants are at a higher risk for complications. Since they do not have enough stores of this. And for the food sources of these, we are looking at the vegetable oils and spinach, I think so. And also people have talked of the seeds and nuts being able to give us adequate amounts of these. Right, so now let's look at the clinical considerations of this vitamin E or the tocopherols being introduced into or being indicated to an individual. Right, so the contraindications are known allergies. People with allergies to nuts should not be indicated with vitamin E. If we want to put a dietary modification, then we shouldn't indicate nuts for a person who is having such issues. And also the adverse effects, we are looking at cardiovascular diseases, issues with the central nervous system, gastrointestinal. Then we also have the genitourinary and also the musculoskeletal issues could happen if someone is indicated with this. And it is also available over the counter. That is what we call OTC. In health, we have a lot of abbreviation. So it is always good to use them sparingly. Right now, over the counter in pharmacology will be OTC. But then when we talk of outpatient therapeutic care in nutrition, still it is going to be OTC. So it needs to be looked at and be used sparingly. And we are saying that for some individuals, you want to supplement with vitamin E. We are saying that there are some major issues that could happen due to malabsorption. Okay. And we are saying they are given in oral and also a topical administration. And I think there are also some other forms of cancer that are known to bring about issues that would necessitate you to stop or withdraw the indicating of the vitamin E. Okay, and also issues to do with the Alzheimer's disease have been known. So now let's interest ourselves with vitamin K. And the only thing I remember growing up when people were talking about vitamin K, they are saying it is the vitamin that is got from what was it? Was it cabbage? It was something that was interesting, particularly when I was growing up in the area where I grew up. So the three types, we have the phanatodium, which is a vitamin K1, then the menaquinone, which is a vitamin K2, and then the menadione, which is vitamin K3. At least if you could grasp a few of these forms or formats of the vitamins and know that the other ones are tocopherols. We have the ivocalciferols in vitamin D. Then we have the phenatodine in vitamin K1 and the menaquinone or the menadione as vitamin K3. That would put a smile on our faces in the long run. So it is essential for blood coagulation factor synthesis in the liver, and also it is essential for coagulation disorders and hypoprothrombemia. Okay, when there is low prothrombin in blood. Okay, so the serum levels, you're looking at 0.1 to 2.2 nanograms per milliliter. And also its clinical considerations, it is contraindicated when there is a drug allergy. And we are also saying that it has some interactions with warfarin, which is with warfarin, and it is used to reverse its effects. Okay, sorry. We are saying it is the toxicity is primarily in newborns of this vitamin K, and also it can be administered through intravenous, subcutaneous, and also for reversal of warfarin. Water-soluble vitamins and B. Water-soluble vitamins and hello. Am I still audible? Hello? I can't hear from you.
Yes.
I'm still audible?
Yes, it's clear.
Hello? Yes, hello.
Yes, it is clear on this side.
Oh, I can get you now. I was seeing my network reducing, so I thought you guys were not getting me.
Okay.
All right, thank you. So we're talking about its contraindications with if the drug is presenting allergic reaction due to vitamin A, but also we are saying interaction with warfarin, and the medication warfarin is taken by individuals to help regulate blood clotting. Yeah, and we had also said that its primary toxicity being to in the newborns, and also we had talked of its routes of administration being intravenously and subcutaneously if we are trying to counteract the effects of warfarin. Right, so now let's switch and look at the water soluble vitamins, where we are looking at vitamin B and vitamin C. And we know for the vitamin B complexes, these are really very many. From vitamin B1 to vitamin B12. And then for vitamin C, still C, but for vitamin B, well, they only take home from this would say that vitamin B complexes are involved in metabolism. Uh, are involved in metabolism, I should say. Right. Really, we are saying properties promote urinary excretion, reducing body supply, and also adequate for irregular dietary intake is crucial of these vitamins. Because remember, like we had said, these vitamins are water soluble, and we excrete a lot of fluids out of the body through sweating, through tears, through urinating. So we expect that we'll be experiencing a loss of these important vitamins. All right. So the water soluble vitamins, like we have talked of the vitamin C, B, we have the thiamine, which is vitamin B1. We'll look at vitamin B2, which is riboflavin, vitamin B3, which is niacin, and we had seen niacin is affecting hyperlipidemia. We can look at pantothenic acid, which is vitamin B5. Then I think it is pyridoxine, which is B6. Cobalamin, vitamin B12. Then the folic acid, which is vitamin B6, B7, one of the two, biotin or folic acid, one of them is B6 and B7. Right. What are the normal serum levels? We have 66 to 200 nanomoles per liter, and the deficiencies could lead to beriberi or Wernicke's encephalopathy. And I hope we all have heard about beriberi. And for people taking nutrition as a course, we know that this beriberi is primarily caused by vitamin B1, and it affects both the nervous system and also the cardiovascular system. Where that is when people are talking of the dry beriberi and also the wet beriberi, things to do with the wet beriberi being for the nervous system, and also the increased heart rate in the dry beriberi. So these are things for the Wernicke's encephalopathy, we are looking at this being a neurological disorder, still from the vitamin B. Here you're looking at the mental confusion and etc. And these are things that usually we as Africans from these developed and undeveloped worlds we didn't know about. And someone could call it witchcraft, or someone could call it another issue, or something that can be done. If that can be done from a traditional point of view. Right. So essential for carbohydrate metabolism, like I had said, these ones, the vitamin B complexes, we'll see that most of them are essential for carbohydrate metabolism, and also we are looking at the peripheral nervous system, the central nervous system, and also we are looking at the GI tract. Okay. Central nervous system, I think we know that is the brain and the spinal cord. And for the peripheral nervous system, we're looking at all those other nerves that are outside the central nervous system. So the contraindications are not supposed to be given when there are drug allergies, and its adverse effects are nausea, edema, and also we are looking at hypersensitivity reactions. And it can be given if it can be given orally or through an injection. That is when we are talking about its route of administration. Really, when we talk of pruritus, we are only talking about itching, basically. Okay, yeah, let the word not confuse you, but we are talking about itching basically on the skin, or also any other membranes. I should say. Now let's shift and look at riboflavin, or what we call vitamin B2. And we are saying riboflavin deficiencies could lead to cutaneous or corneal changes, and it is essential for respiratory function, and also catabolism. Still, you could talk about it as being crucial metabolism and etc. So they are key for converting the macronutrients when we take in the carbohydrates. So turning them into usable energy. If you look at also that metabolic pathways from the glycolysis, the Krebs cycle things, you will see that all these ones play crucial roles, and also they protect cells from damage from these radicals. When we talk of the foods that are indicated here, we're looking at the lean meats, we're looking at nuts, and etc. Contraindications, we're looking at drug allergies, and also for there are no significant side effects, and also the administration of riboflavin is really oral. Vitamin D3, we're looking at it as essential for amino acid found there, and it's an essential amino acid found in dietary proteins and supplements. Okay, and it leads to deficiencies of deficiency of vitamin B3 or deficiency of niacin leads to pellagra. And these, when we talk of pellagra, we are looking at the lack of niacin in the body and what it leads for people who really, and I think this was some research done where people are looking at dermatitis, that inflammation of the skin, also being predisposed to basically the pellagra, and also for people suffering with pellagra, they are experiencing the vomiting, the diarrhea, the dementia, and also mouth sores, swollen tongues. Those things usually happen to them. So when is it contraindicated? Due to drug allergies, when there is severe hypotension, then also arterial hemorrhage, and also if someone is having active peptic ulcers, then we do not give that vitamin B3 or the niacin. So what are the adverse effects of niacin or vitamin B3? We are looking at them as being flashing, okay? And if someone is exposed to this, there could be high mortalities or high morbidities, one either way. We're looking at the central nervous system. Someone could experience headaches, could experience dizziness, fatigue, blood vision, and also for the gastrointestinal, the person could feel abdominal discomfort, and also we could see them emptying their bowel contents through vomiting or diarrhea. For the genitouria, we are looking at increased urination and urine frequency. Remember, these being water-soluble vitamins. And for the hepatic, we are looking at elevated hepatic liver enzymes. And in rare cases, we tend to look at hepatitis. And metabolic, we could look at hyperglycemia since it is required in the breakdown of these. It is required in the breakdown of the carbohydrates into glucose. Then we talk of increased glucose levels in blood. Its route, it is given orally, and an onset of about half an hour to an hour is expected to be seen, and also peak plasma concentration is reached at 45 minutes, and also an elimination or half-life is reached at 45 minutes. And we are saying it is we are saying its mode of action, it is variable depending on it is dependent on individual factors or patient-based factors, really, I should say. So these are things that we need to always be looking out for. Okay, yeah. So basically, we talk of the oral route, we talk of its onset, we talk of the peak plasma concentration, we talk of elimination half-life. When we talk of half-life, really, we are trying as much as possible to tell you the amount, okay, the amount of time the drug takes to decrease its concentration by half. Okay, so that is how we term it as half-life, the amount of time that the drug takes to be reduced by half for its concentration to drop or to be reduced by half. All right, so now let's look at vitamin B6. And vitamin B6, or what you could call pyridoxine, and its deficiency is it is not only one type of anemia. And every time people talk of anemia, we rush and categorize all anemias as as iron deficiency anemia. But actually, even we forget the most common one, that we have sickle cell anemia that is always staring at us. We have the pernicious anemia. We'll see that we have megaloblastic anemia. But now deficiency leads to sideroblastic anemia and also neurologic disturbances, cirrhosis, and also xanthorrhenic aciduria. Okay, yeah, when there are a lot of acids in the urine. Right. This vitamin B6 really is key in the water soluble vitamins because it is essential for enzymatic actions. Like I had said, most of these vitamin B complex the B complex group vitamins they basically or essentially for metabolism. It is vital for peripheral nerves, skin, mucous membranes, and also hematopoietic system integrity. All right. What are the clinical considerations? We are looking at it being contraindicated. Most of these are contraindicated if someone is showing allergies. Okay, and its interaction. Interactions. We are talking about it being the only interaction we could talk of. It must be we should not only give it with Livapoda, which is a treatment that is given for people who are having, if I'm to remember correctly, for people who are having, is it Parkinson's disease? Yeah, I should say, I think something to do with the dopamine neurotransmitter, something like around that route. Yeah, and also adverse effects, we're looking at integumentary and also the central nervous system, and it is indicated orally. All right, and its half-life, we're looking at it being 15 to 20 days, and the duration of action of this is unknown. So then let's look at cyanocobalamin, which is a vitamin B12. And this is essential for body fat and carbohydrate metabolism, protein synthesis. And when you talk of protein synthesis, still we are looking at cell replication, blood cell production, and normal nerve function. We are seeing that most of these big group vitamins are key in the actions of the nervous system, the central nervous system and the peripheral nervous system. So the causes include malabsorption, poor diet, alcoholism, of the deficiency of the cyanocobalamin or the vitamin B12, and this manifests as a megaloblastic anemia and pernicious anemia, and those will be asked to you. Trust me, in one of your engagements, these things will come up. And what are the major causes? This could be due to malabsorption, where the body is failing to absorb the required amounts of this vitamin B12 due to GI lesions and also due to surgery. So it is contraindicated when people are experiencing drug allergies, and it is also we talk of when there is hereditary optic nerve atrophy, also interactions decrease the absorption of anticonvulsants, okay, and also the aminoglycoside antibiotics, and also we are looking at long-term acting potassium preparations. We had looked at potassium yesterday, and now we are seeing vitamin B12 is not indicated if someone is having these long-acting potassium preparations. So the adverse effects are still the common ones: the cardiovascular diseases, the cardiovascular conditions. We could not call them cardiovascular diseases, but we are calling them cardiovascular conditions that could come in there. You could see a slight dip in bradycardia. You could see maybe you could talk of hypertension coming in a bit there, here and there. But also we are looking at issues to do with the central nervous system and also metabolic disorders. It is taken orally, and we are looking at its peak plasma concentration appearing after 8 to 12 hours. Okay, and then that is when you need to know the dosage, and all these help us in understanding the dosage, when to give what and when to give. That is why you see people. It's only some here in our developing countries that people can even prescribe to you drugs without taking your weight. Okay, someone could just say, "Who are you taking the drugs for? Is it a child or is it an adult?" Then it is, if you say an adult, then they will just generalize a formula for adults. But ideally, these drugs work customizable. These drugs, the dosages are customizable, and those calculations need to be done to make sure people are supplied with the particular amount of drug that is going to be of efficacy to their health. All right, vitamin C, or what we could call ascorbic acid, and this one we have seen, and we all know that it is its main source is from fruits, but also the green plants also give us some vitamin C, and it is used in prevention and treatment of scurvy. If you will interest yourselves with epidemiology, you will come across a famous man for this. I think it was the first randomized control trial. James Lind, Captain James Lind, okay, who was sailing on MS Salisbury. I'm forgetting the year. So in your epidemiology, they will teach you this, that he did that trial where he got some sailors and gave them vitamin C. Remember, these sailors spend a lot of time on the sea, and on the sea they do not have access to these fruits, right? And hence, some sailors were developing the vitamin, the scurvy, or what we call a vitamin C deficiency. So, what this man did, he grouped them in two groups, and for one group, he added some. I think he gave a fruit. Is it a juice or a fruit? I'm forgetting. Yeah, but clearly he showed the role of vitamin C in preventing scurvy. And you know how scurvy presents with the bleeding gums and etc. Get back to class. We are looking at required for erythropoiesis and also collagen synthesis, tissue repair, and also bone synthesis. The deficiencies we are having gingivitis. Gingivitis, we are looking at weak gums, bleeding gums, etc., and anemia, bone lesions, and also delayed wound healing. It is contraindicated for people with allergies, and its adverse effects are usually non-toxic, and its excessive consumption could lead to scurvy-like symptoms. However, in most cases, we understand this powerful antioxidant in the body really plays a lot of roles, but really let's limit it to basically its role it plays in preventing scurvy. Okay. Yeah, but also things to do with its immune functionality, things to do with it promoting the production of cytokines that help us in fighting infection. And we had known that its good sources come from those citrus fruits, oranges, and etc. Co-administration, it is administration with acid labile drugs. These acid labile drugs, once indicated, should be avoided. All right. So lastly, we are saying it is given orally, and its duration of action is not known. So colleagues, thank you for attending this. So let's meet tomorrow, unless there is something you want to share. Yes, Tito. All right. If there is nothing, I beg to end the presentation here. Let's meet tomorrow.
Yes, thank you so much.
All right. You have a good evening.